Hello, today we are going to demonstrate the cooled radiofrequency ablation technique of the hip. Unfortunately, hip osteoarthritis is a very common complaint in our older adults today, and there are certain patients that are not good surgical candidates. Either medical comorbidities, weight, or the patient themselves is very resistant to having surgery at this time. So this cooled radiofrequency ablation technique is possibly an alternative for those patients. The hip joint is actually innervated by articulate branches of four major nerves. The anterior medial aspect of the hip is innervated by the articular branches of the obturator nerve. The anterior lateral part of the hip joint is innervated by the articular branches of the femoral nerve. Posteriorly, the superior gluteal nerve innervates the posterior lateral, and the sciatic innervates the posterior medial aspect of the hip joint. In studies, they've actually determined that the articular branches of the obturator and femoral are major contributors towards pain. Thus, we are going to do cooled radiofrequency ablation on those articular branches today. When I have a candidate for hip radiofrequency ablation, in my personal practice, I first block the two articular branches of the femoral and obturator nerve with 2 cc's of bupivacaine. I'm looking for greater than 24 hours worth of relief at least 50%. If this is a positive response, I go ahead and schedule them for a radiofrequency ablation of our articular branches of our femoral and obturator nerve. To start with, we will demonstrate the needle positioning to deinnervate the articular branches of the obturator nerve. The key landmark for the articular branches of the obturator nerve is this point here, which is known as a teardrop, which is actually the inferior border of the ischium and pubis. Initially, when this particular technique was started, we would place our needles perpendicular to the ischium. However, the femoral artery and nerve generally run in that very same plane. This created significant hematomas and was a complication that obviously we now want to avoid. Through multiple studies, they've determined that a 70 degrees sagittal approach coming towards the teardrop is the preferred direction of choice. I will choose a point here in the inferior part of the acetabulum. I will localize with anesthetic that particular landmark, and under fluoroscopic control, guide my needle to the lateral border of this teardrop. Here, I have bony contact with the teardrop, and this is where I would prefer my needle would be placed. Attention is then turned to the needle placement to deinnervate the articular branches of the femoral nerve. Again, our target zone is the anterior lateral aspect of the hip. Come inferior to the AIIS, the anterior inferior iliac spine, to have a slightly oblique positioning of the needle to have a better burn of articular branches. I would anesthetize with local anesthetic and place my cooled radiofrequency ablation needle. Under fluoroscopic control, I would then guide this needle to the osseous endpoint of the anterior lateral hip joint. So now that I have placed my needles in their desired locations, I would want to do motor stimulation. We will start with the needle for the articular branches of the femoral nerve. I motor that for 2 hertz at 2 volts, making sure I do not have lower extremity femoral nerve stimulation. I will confirm again with an AP image with our introducer in place that I like proper placement. I'd put 2 cc's of 2% lidocaine in prior to my commencement of burn to try to decrease post-procedure pain. I would then burn for 2 minutes and 30 seconds at 60 degrees centigrade. Attention would then turn to our second needle, burning the articular branches of the obturator nerve. Place the needle, the introducer. The thermocouple is just lateral to our teardrop. This is placement that I prefer. I would again motor stimulate for 2 hertz, 2 volts, making sure I don't have lower extremity obturator nerve stimulation. If I am pleased with the lack of motor stimulation, I personally will place 2 cc's at 2% lidocaine, again to try to prevent post-procedure pain, and burning will commence for 2 minutes and 30 seconds at 60 degrees centigrade. This would then complete our cooled radiofrequency ablation of the hip joint. Thank you very much.